Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
X-linked hypophosphatemic rickets. X-linked hypophosphatemic rickets are also called as renal rickets or vitamin D resistant rickets. These renal rickets are the most common type of hypophosphatemic rickets which are occurring due to renal phosphate wasting. These X-linked hypophosphatemic rickets are X-linked dominant disorder. Here there is mutation in phosphate regulating gene with homology to endopeptidase on chromosome X. Here there is mutation in PHEX or PHEX gene. Because of this PHEX gene, which is nothing but phosphate regulating gene with homology to endopeptidase on chromosome X. So whenever there is mutation in this PHEX gene, it causes reduced phosphatinin degradation such as a fibroblast growth factor 23, and thus because of reduced phosphatonin degradation there is increased phosphate excretion is seen. The calcium is normal, phosphate is found to be increased, paratharmone is normal, and 125 dihydroxy vitamin D3 is in low normal range. In vitamin D dependent rickets, calcium is normal or low, phosphate is decreased, and paratharmone is increased. Whereas in hypophosphatemic rickets, calcium is normal, phosphate is decreased, and paratharmone is normal. Treatment of hypophosphatemic rickets. In hypophosphatemic rickets, the patient is given oral phosphorus in the dosage of 30 to 50 milligrams per kg, has Joule solution, or phosphate effervescent tablets can also be given along with 125 dihydroxy vitamin D3 supplementation. The new alternative for this vitamin the new alternative for hypophosphatemic rickets is bursozumab can be given. This bursozumab is a monoclonal antibody to fibroblast growth factor 23. Fanconi syndrome.
thank you and thank you for watching.